Good morning or good afternoon, depending on when you are viewing this presentation. I'm Janie, a community pharmacist based at Leeds Student Pharmacy, and I'm going to talk to you today about what your local community pharmacy can do for you. So most of you probably know that pharmacies can dispense your prescription, can give you help and advice about healthcare products. And lots of you probably know that you can now go to your community pharmacy for your flu vaccination, which will obviously start again in September this year. But community pharmacies have so much more to offer. Like lots of businesses, pharmacy has had to adapt since the start of the pandemic. Community pharmacy had to put lots of COVID safe measures in place. But despite COVID, we continued to open throughout the pandemic to support our patients and our local communities. Pharmacies have always been available to offer support and guidance on a wide range of health and wellbeing services. But during the pandemic, when the GP surgeries had to close their doors for safety and were only doing remote consultations, many people turned to community pharmacy for their healthcare needs who hadn't necessarily used this service before. And it's so great that we are now being used more often and being a first port of call rather than automatically going to see your GP. One of the best things about pharmacy is its convenience. Many community pharmacies are open until late every day, some as late as midnight. A lot open on Saturdays and even Sundays, and a number of pharmacies within any community will be open for public and bank holidays. Consultations with a pharmacist are always free and they're always confidential, and the great thing is, unlike with your GP, is you don't need to make an appointment. You can just walk in and ask to see the pharmacist or one of their healthcare colleagues. Most community pharmacies also have private consultation rooms, so it means that you can discuss any of your concerns or queries in private without being overheard by other members of the public who might be in the pharmacy for different reasons. Obviously, during COVID, numbers are restricted anyway, but there's always that private space that you can go and talk to the pharmacist about anything that you want to discuss in private. More recently as well, to try and take pressure from the GP now, for a lot of minor illnesses, may well ask you to go and see your pharmacist rather than come in and have an appointment with them. So often, if you are suffering from a minor illness, which we will discuss in a further slide, you'll probably save time by going to see the pharmacist directly and not bothering the GP at all at that stage. The great thing as well is pharmacists aren't tied to appointment times, so we don't have that 8-minute slot that lots of GPs work to, and therefore with more time and to answer any of your concerns or questions, and we're not going to sort of have to throw you out after 8 minutes. These more flexible hours and the fact that pharmacies are all over the place and often at much more accessible locations means that it can be quite often easier to go and see a pharmacist and quicker. And also for lots of us who work, like the staff at the university or the students who've got lectures to attend to and stuff, it means it doesn't have to impact on your working day. You can actually go at the weekend or pop out in your lunch hour or go and see the pharmacist on your way home, because they'll be open later hours usually than the GP. So the NHS really wants people to decide to manage their care by visiting a pharmacist first for these minor illnesses rather than going straight to their GP, and are encouraging more and more patients to do this when it's appropriate. This will help the whole of our National Health Service. It will mean that because we're not tying up GP appointments for things that the pharmacists could sort out, that GP appointments will become less hard to come by when you really do need to see a doctor. And it means that those that do need the care of the GP because they have very serious clinical needs can get an appointment in a timely manner and don't have to wait ages to see the doctor because there's no appointments available. Obviously, the expertise of GPs is totally invaluable, but as I've said, there are plenty of situations when you don't necessarily need to see your doctor and that your community pharmacist might be a better option. Pharmacists are the experts in medication, and you can always come and talk to us about your prescription and your medication needs, but we can also offer clinical advice for a range of minor illnesses. We'll discuss these in the next slide. And do remember that the training that pharmacists get means that we can either give you the help you need, or we know where to refer you to so that you can get that help. And if we can't help you, we will make sure we signpost you or refer you to somebody who can. So some of the illnesses that you can come and see a pharmacist for without going to see your GP are listed here. We'll go through some of them, but I want to just make a point as well that as a employee of the university who probably works, or a lot of students once they turn 19 have to pay for prescriptions, and each prescription item from your GP costs £9.35. And even if you make an appointment to see your GP with one of these conditions, they may write you a prescription, but when you bring that prescription to our pharmacy, if it's £9.35, but we can actually sell you the item for £5.50, we'll say to you, well, don't worry about your prescription, we'll just sell you the item. And if you'd have come and seen us and not had your appointment with the GP, you could have just bought the item over the counter. And quite often if you see your GP, they won't write you a prescription, and they will just say, pop to your pharmacy because you can buy this cheaper than I can prescribe it for. So that's something that's worth bearing in mind as well. So some of these minor illnesses, aches and pains, whether it's a headache or a migraine, back pain, period pain, toothache, all those. We've got medication that we can sell you over the counter for all these types of aches and pains. And obviously along with that sale becomes the advice, how to take it correctly, how to protect your tummy if it could damage your tummy by taking it, how often to take it for, what to do if it gets worse. So each of these illnesses, not only are we selling you something to help make you better, but we're giving you a wealth of information and support around that. Obviously, there's allergies to all sorts of medications or other things, but also if you're suffering from hay fever or you've had a bite or a sting, we've got lots of products to sell you and information we can give. Obviously, as we come out of the pandemic and we mix more, there's lots of bugs floating about, and lots of people are starting to suffer with colds and flu and other sort of seasonal bugs. So if you're suffering from a cough or congestion, whether it's in your nose, your sinuses, if you've got a sore throat or a temperature, again, we can give you the advice you need and sell you some products. And at any of these points, if we believe that actually it's more serious and you might need antibiotics, for instance, then we will refer you to your GP and make sure you get seen and get the product you need on prescription. Ear and eye care, people suffer from earwax or minor ear infections, which can actually, there is a product on the market you can buy over the counter. Conjunctivitis for your eyes or a sty, again, lots of products available. And obviously during the pandemic, lots of us have been working at home remotely, and our eyes have suffered from staring at screens. We don't blink as often when we stare at computer screens as we should, and lots of people have suffered from dry and sore eyes. And there's lots of products and information we can give you to help improve your eyes if you're working a lot on a computer. With your stomach, there's constipation, diarrhea, nausea and vomiting, maybe suffering from indigestion, or acid reflux, and all those kind of things. We've got products that we can recommend and also give you tips on maybe diet if certain things are triggering those kind of responses. And then also things to do with skin or your mouth, athlete's foot, scabies, thrush. There's lots of other things out there that we can help you with, and this isn't an exhaustive list. You can always pop in and talk to us if you've got a concern about something, and again we can say yes, we can sort you out, please sit down, we'll have a chat, or it'll be, well actually no, for something like that you need to go and see your GP, and then we'll help get you referred across to get an appointment. But pharmacy isn't just about health. This week that all these presentations are out there for staff and students to access is about health and well-being. And your well-being is just as important as your health. And pharmacists can offer a wealth of advice on healthy living and healthy being, whether it's diet or exercise, whether you're determined to stop smoking, whether you've got sexual health concerns. Again, we can have private consultations and help you set up a diet plan or help you with your weight monitoring or whatever it is you might need. Alongside that, we provide services such as emergency contraception, travel vaccinations and anti-malarials if you go into a country where they're required. If a lot of the students are on oral contraceptives, and we can take your blood pressure for you, which might mean you don't need to see your GP, because if you can tell them your pharmacist is taking your blood pressure, they might release another of your repeat prescriptions. And also we can support with anxiety and depression. You might need a medication from your GP, but we can give you tips and ideas on how to support your medication and how to deal with your anxiety and depression, especially for students, say at exam times or whatever. So come and see us before you feel yourself getting worried and anxious, and we can look at tips and tricks to how you can cope with those feelings before they become too strong. So it is so important to use your local pharmacy. If you want to find out, every local community pharmacy is different. If you want to find out what they offer, just pop in and ask them. Obviously, there's lots of pharmacies local to the university. I just work in one. We're across from the Parkinson Building steps, but there's lots up in Hyde Park. Or if you're a member of staff, your local pharmacy is probably local to your home. But there's lots out there. Please go and use them. As I said, I'm based at Leeds Student Pharmacy, opposite the Parkinson Building, and I would love to see anyone if they want to pop in for some support or advice. And if I'm not there, another pharmacist is always there to talk to you. But whichever pharmacy you choose, wherever you live, wherever you go, hopefully you're guaranteed a friendly staff who will help and advise you with all your health and wellbeing needs. So in summary, pharmacists out there can assess and advise you on a multitude of health and wellbeing conditions and make the appropriate judgment about what is required for you as an individual. That might be that they can sell you a product with advice, or it might be that they can signpost or refer you to a professional who can help you if they can't. I hope it's reassuring to know that pharmacists across the UK are performing this role thousands of times each day for thousands of patients, and we want to be there for you and give you that health and wellbeing support. We are a great resource, and until the recent pandemic, I think sometimes pharmacy was underutilised. But obviously with the doctors closing the doors during the pandemic, people have started to come and see us and realise that we can help and we can be reassuring, just as your GP is. So my hope is that as the world returns to normal and GPs reopen the doors, that you won't forget us lovely community pharmacies, and you will come and use us and help us and let us help you with your health and wellbeing needs. Thank you for listening, and as I say, if you do need any help and advice and you want to come and see me, feel free, but otherwise there's lots of pharmacies out there. Go and make the most of them for your health and wellbeing needs. Thank you.